Is it possible to transfer fat from liposuction to other parts of the body like the breast, butt, or face?
Yes, it is. And you have hit the three most popular places that we will do a fat transfer. So fat transfers are very interesting. We started learning about them a long time ago, and that means taking out fat and then transplanting it to another part of the body. And one of the things that was done in the past was for someone who had a mastectomy and had a scar across their chest and then radiation and then had difficulties with healing and maybe some chronic wounds from the radiation. Because the skin was so leathery and stuck down, some surgeons started putting some fat under it. And remarkably, the scar and the tissue started to soften and look better. And so we kind of figured out that the fat is talking to something in the skin and actually making it look better and improving. So the fat's pretty healing. And so a lot of the things you hear about with stem cells and exosomes and all this kind of stuff, it's derived from the fatty type material. So one of the popular places we'll put it is into faces. And so face fat grafting is super common, and I think very important, because one of the primary things that ages faces is loss of fat. And so by restoring some fat, we actually kind of reverse a lot of the aging process. And fat doesn't look puffy, or like if you overuse fillers, you can look kind of swollen and puffy, but with fat, it looks very natural. So it's very good for your face. So that's a real popular place to put it. Buttocks, as you mentioned, is another one. And so when we're doing liposuction or tummy tuck and liposuction, we can also fat graft into the buttock area, which increases the volume, obviously, and then changes the shape. And so a lot of patients, if they're standing sideways and you look at them, they'll kind of complain that my back and my buttocks are almost a straight line. And so we want to create a curve with the lower back going one way and the buttocks going the other way. And we can do that a couple ways. We can do liposuction and move the back forward, and we can stop if that's going to be enough. But if we want more curve, we can do liposuction and move the back forward, and then do a fat transfer and move the buttocks backward, which accentuates more of an S when you look from the side. And so fat transfer to the buttock is also, a very popular procedure. The last one you mentioned was the breast. And so, yes, you can move fat into the breast. It typically gives a very modest amount of gain in volume. And so it's nice for small things like creating more cleavage, or if you're very thin over the implant, getting a little bit more volume, which would maybe help soften the look. But growing large amounts of volume, if you think about the breast as a honeycomb matrix, you can drop one drop of fat into every cell, which means like if you have a larger breast, you can put a lot of fat in, which would therefore make a larger change. If you have a tiny breast, we can only put a couple drops in before it's full, and you don't really have that much change. So if you're thinking about breast fat grafting to the breast to increase volume, it kind of helps us start off with a little something. If you're pretty flat, it's not going to be the most effective procedure for you.